So in this lecture, inshallah, we'll talk about SBAR communication. And SBAR communication is the chosen method for reporting of critical values and handover in KMC. And SBAR method, you know the abbreviation for SBAR is an abbreviation for 4 words. S for situation, background, assessment, and recommendation. And may I ask you if anybody of you use SBAR? Yeah, using SBAR for endorsement? Exactly. What else?
Receiving information to OR.
Yes, receiving information from OR. What else? Or to OR? What else?
Not mentioned the way also about just like critical value.
Yes, informing about critical values. Okay? So the importance of using a structured way of communication is that you speak standard way, the other person know this standard way. When you speak together, you complete. Like if you miss something, he will ask you about the assessment. If you miss the assessment, he will ask you what's your recommendation. Okay? And you know you have to start by the situation, then the background, then the assessment, then the recommendation. So it orders you, it makes you committed to the way of communication and complete communication. Okay? And because usually during emergency, during handover, there is a risk that you will miss some points, you will not communicate it to the other person. Okay? So you will not achieve the purpose of the communication. You will not achieve that purpose. So it will be miscommunication, something missing, then the other person will not be able to continue the care. Okay? So our topic today, our objectives to explain what SBAR stands for, and list the benefit of SBAR, explain how to use SBAR and apply it in clinical situations. Okay? So SBAR stands for situation, background, assessment, and recommendation. So it's a structured method of communication, and usually for communication in emergency. Okay? For communication in emergency. So history lesson. Where or when was SBAR started? SBAR started usually in the beginning in the military. So there was an incident in the military. They were particularly in nuclear submarines. Nuclear submarines. And you know what's a nuclear submarine, right?
Yes.
So it's a submarine, you know submarine, that's a military vessel that goes underwater, in deep water. Okay? It can go undetected behind enemy lines. And it has capability to be nuclear, means first of all, it can be run by nuclear fuel, or it can be able to have a nuclear weapons. So nuclear submarines is the last or the most important weapon in any military arsenal. It's like big countries that have nuclear capabilities, they have nuclear submarines. Any other weapon can be detected, can be apprehended, but nuclear submarines cannot. So nobody knows anything about them. If the war started, nuclear submarine is the most strong weapon. Okay? These started to use SBAR because there was an incident, and this incident there is a risk to launch a nuclear attack preemptively without indication or by mistake. Okay? It's not only life-threatening to a bunch of people, it's life-threatening to the whole world. So they started to use SBAR because they found out the error was due to communication error. Okay? The communication error led to the actual error, the physical error. So one person gave the wrong message to the other person, and he did not really carry out the message properly. The other person perceived it wrong, and he did a wrong action. Okay? So this came up with SBAR communication. Come forward in time, it moved on to aviation industry. So in the airplane also needed to communicate with the flight control towers, with the airport, with the cabin crew, with everybody need to communicate to arrange the takeoff and landing. So all of this is high risk procedures. Okay? high risk, life-saving or life-threatening procedures if done wrong. Okay, so they started to use SBAR communication. And these industries will not use anything just for fun. They will not use it just to fill papers and to impress others. They are not interested to impress anybody. Okay, they want to organize themselves to minimize risk. Okay, so if you think SBAR to impress others or to fill papers or to just carry out a policy indicator or just someone asks you to do it, this is not the point. It was initiated actually to minimize risk. Then it moved on to healthcare and rapid response teams in Kaiser Permanente organization. And if you research online Kaiser Permanente organization, one of the highest standard of care done in this is being carried out in this organization. Then from there, GCIA picked it up and spread to other healthcare organizations. Now it's widely used standard. Okay, so GCI recommend to use SBAR communication and healthcare communications. Okay, so why do we need SBAR? Lots of things said. It's a simple thing. Okay, it's simple acronym, and it makes us remember the important points. Easy to remember. Prevents breakdown in communication, so I will always have complete communication. Common language platform, okay? Even I have cultural difference, education, a little bit different, I have different practice, but all of us agree on SBAR, okay? Then structure, make the structure to the conversation, so you know what to start with and end with, or what's in between. Clarifies what information needs to be communicated, so you know what to say, and if you miss something, you already know what you missed. Okay, and points to action, and it's summarize the important information and makes you make decision quickly. Okay, when you give SBAR communication, when you inform the physician with the critical value, if you use SBAR, he will easily have the decision. He can easily make the decision. You will see how. So how to use SBAR? So let's move to this example. First, we'll start with the situation. So in situation, you will mention what is the current problem. What is the current problem? So you initiate any conversation by creating an identification, introducing yourself and identifying what are you talking about. Okay, so identify yourself and from where you are. Then you will identify the patient. Now we are talking about healthcare, not nuclear submarines, right? So we are talking about our own settings. Usually you are reporting health problems related to the patient, right? So you will identify yourself, then you identify the patient. Then you will say your main concern. Why did you initiate the conversation with that person? Why did you leave your place and went to that person and stopped him and started this conversation? What made you do that? So this is your concern. And why describe the specific situation about which you are concerned. So let's have an example. In this example, Muhammad, the charge nurse in ICU, he's approaching the doctor. Let's say the doctor name is Ali, okay? And he approaching Dr. Ali, he said, hello Dr. Ali, my name is Muhammad, I'm a charge nurse in ICU. I am calling you, let's imagine this is a phone call, and he is calling about patient name so and so ABCD and his MRN 12345. So he first introduced himself, then he said the name of the patient and MRN as a unique identifier. Okay? Then he will mention, okay, Mr. ABCD have a chest pain, a new chest pain, okay? Or have a breakthrough pain, or he have a shortness of breath, or he have an oxygen saturation drop. So this is the main concern, okay? This is what you start with, identification and the main concern. Then he'll move on to give a little bit of a background to aid in the decision making. So before the chest pain, what happened? Before the desaturation, what happened? I don't know. what's the background about this patient, or maybe doctor know, but you emphasize your knowledge and emphasize the physician knowledge about the patient. Okay? So you will mention, so this person was admitted for shortness of breath. Reason for admission, significant medical history. He is diabetic, he is hypertensive. Okay? Overview of the patient's background. It can include admitting diagnosis. So he was diagnosed with COPD, for example. Date of admission, admitted 2 days ago. You can mention that in the background. Prior procedures, let's say he's post-operative. He done the ERCP procedure, he done any operation, laparotomy. He is on medication, so and so. This is part of your background. Allergies and lab result relevant to the problem. Okay? And you need also to have the patient chart to pick up this information. So in this example, you will say, let's say information we have, he is a 69 years old man, admitted from ER 2 days ago with a chest infection. So this is an admitted diagnosis. You're telling a little bit of background about the age of the patient, from where he was admitted, and he is known case of COPD, he's a little bit of medical disease he has, and he's receiving IV antibiotics. So this is medications this currently on the patient, and until now he's doing well. So in general, how is he doing? He is doing well, otherwise he is normally fit and well and independent. So this is what happens before this moment. Okay? Before this moment, he have these things. This is the background. So we are telling a little bit of a background. Then, when you have any new incident with the patient, you probably done assessment, right? So if you saw, let's say, the heart rate increase, or if you saw the patient having a pain, if you saw the patient having any abnormality in the labs, you probably done your checking. So let's say if the leads showing arrhythmias, you did check the leads. Maybe you done already 12 lead ECG. Maybe or you already assess the patient for what is the size of, what is the location of the pain, what's the quality of the pain. Okay, so now you did assess the patient. How long the pain persists, is any relieving factors. So you are done some assessment to further your knowledge about this concern. Okay, so there is a new concern and you already did some assessment. So you have to mention it in this step. What did you notice in your assessment? Vital signs change. Okay, does he have tachycardia with that pain? Does he have hypertension? Interventions. What interventions that help to relieve that pain? So vital signs, you can say vital signs has been stable from admission, but deteriorated suddenly. So you are noticing a sudden drop in vital signs, sudden change, sudden abnormality appeared in the vital signs. He is also complaining of chest pain, and there appears to be blood in his sputum. So there is another observation you are making. It may be related to the chest pain, and it has not been receiving any venous thromboembolism prophylaxis. So it's relevant that he is having a blood in his sputum, although he doesn't receive any anticoagulant medication. Okay, so are mentioning all relative information or relevant information in this assessment. So we can say here, in case you don't have any assessment, let's say something new, let's say malfunctioning drain, and that's what you are reporting. There is nothing to be done. So what you want, someone to fix this drain. There is no assessment to be done. You can say, I'm not sure what's the problem, but I am worried. Okay, for example, this is something new, no assessment to be done, or you are not sure what assessment you should do. You can say that you are concerned and you are not sure what's the problem. Then you can mention your recommendation. Okay, your recommendation can be, for example, if the patient has on pain medication already. This also based on your awareness of what's the diagnosis, what the treatment running on the patient. So he's on pain medication, and this pain medication, let's say in low dose, he have chest pain. You may recommend increasing the dose of those medication. For example, maybe the patient have hypoxia. desaturation, and he is on oxygen. You are recommending to switch to higher flow device. Instead of nasal cannula, you move to face mask. So this is your recommendation. Why it's important to add your recommendation? Isn't the doctor who will take the decision at the end? Am I right? At the end, the physician who will give you the authority to do this or do that, right? So why you should add your recommendation? Why you should add your recommendation? Because,
I'm the main focus for the patient of the primary.
main focus?
Yeah.
What do you mean by main focus?
I'm in contact with patient so I can detect more problems.
Exactly. So probably you are aware of this situation more than the physician. You already have experience. Let's say some interventions was helpful with this patient. Maybe you know something that can work. Okay, recommending that makes a decision as a team. You and a physician as a team. It's not like autocratic way of taking decision. You are adding your contribution to decision making. Usually your decision is right. Usually is your opinion. Your recommendation is right. It's what should be done. Okay. Usually it is the confusion of the physician. Maybe you are pointing the physician to the right way. Okay. So also like there are things that you know about the patient. Maybe you didn't mention. Okay, in your conversation that makes you think this is the right way. So recommendation can be. So the recommendation can be what needs to be done further. Let's say, would you like to do X-ray? So if patient have chest problems, have chest pain, right? So it's a good idea to do an X-ray, right? So it's easy to make this suggestion, right? It's not difficult. So I have a pain in the chest. What about chest X-ray? Maybe pain in the chest. What about a 12-lead ECG? Maybe he's having shortness of breath. What about an EBG, right? It does make sense. Okay, so you recommend those things, and maybe the patient is hypotensive. Maybe you recommend to give fluid, right? And or if you have like nothing to recommend, you can also ask the physician to come immediately because it's an emergency. You thinking this is an emergency is one of the indications that to do an SBAR communication, okay? Like you don't feel right about what's changing in the patient, okay? Like one of the criteria for RRT, when we initiated the RRT criteria 1.5 years before, the references in our hospital include nurses worried about the patient. All of you has been exposed to RRT criteria. Okay, working in the world, you know what's RRT criteria. You open that chart, right? Hypotension, new tachycardia, bradycardia, drop in blood pressure by 40, right? Right or wrong? Okay. One of the indications to call for RRT is nurses worried about the patient. Okay, so if you are worried about the patient, just worry about the patient. No need for specific numbers. You cannot explain. I think the blood pressure is okay, heart rate is okay, but I don't feel right. This doesn't feel right about the patient. They include it even in the NHS in UK. They are using this as RRT criteria. Okay, so don't neglect your feelings if you feel the patient is in risk. So you can say, please come immediately. Okay. So in this scenario, we will just combine what was said in each step. So in situation that charge nurse introduce himself and the patient and the place of the patient, the main concern with chest pain and difficulty breathing. Then he move on to explain the background. The patient is elderly and is from ER, have chest infection, and he have a history of COPD, DM, and hypertension. He is on antibiotics before. The charge nurse did the assessment, found out the patient have vital signs, stable vital signs, and he's just complaining of chest pain, and he have blood in his sputum. Then he recommended an X-ray and EBG and the physician to come to see the patient. So this was the conversation. Here is imagined to be done through phone, also can be through verbal, it's the same thing. Okay? You're changing from calling to I'm talking to you, same. Okay? So you have to say these things you see, it's more clear now to what to do for this patient, right? Okay, so simply like if you say one thing that's just a concern, without mentioning the background, without doing any assessment, without recommending anything, it's miscommunication, right? It's deficient, right? So the other way, or the other scenario that you are using SBAR communication is when you endorse the patient to your colleague. Now the other one was nurse to physician. Okay, other one also physician to physician, but I'm talking to nurses now. So nurse to nurse handover will be done at the end of the shift, at the beginning of the shift, at transferring of the at the time when you transfer the patient to other department, right? So you need to do the handover. So what you will do is not an emergency probably, okay? During handover, it's a routine job, it's a routine task to be done every shift to hand over your patient to the next shift, right? There is no emergency. So what should you do during the S phase, the situation? What should you say in the situation? Present condition of the patient, exactly. So what's the present condition of the patient? He is stable, he is unstable, he is for procedure, he is something that's main concern about this patient, okay? If you saw charge nurses speaking about patients, and they usually do brief discussion, like 2 minutes each patient, some 2 minutes. When they do that, they usually say the main situation, this is the main problem for this patient, because charge nurses, they will not manage the patient in complete way. They will usually manage the main concerns, right? They cannot manage everything, care for the patient. They will say the main concern. So this is like mentioning the situation. So first identify the patient and the main problem that keeps the patient in this department. Okay, the main problem. Usually also, usually patients are hospitalized for something, right? Why is he hospitalized? He was at home and he had a problem, and this problem brought him to the hospital. There was an acute problem, then this problem become chronic or prolonged. Then he stayed in this department. Why he does not go home? Okay? You have to ask yourself, why this patient does not go home? So you answer this question, you can mention the situation. Okay, so you can say he is here for mechanical ventilation, he is here, he having respiratory failure, he is in shock, he is in treatment, he is waiting for operation, let's say, if the patient is in the ward, or whatever. Why this patient is not transferred or not discharged? Okay, so this is what you start with, and at the beginning, when you speak to your colleague, after introducing the patient, reading the sticker information, you start mentioning this patient here is for so and so. Then you mention the background. So the background history. Now you start to say the history. How was the patient admitted? He was admitted because due to diagnosis of so and so. He have this and this. From where he was admitted? What is the medical history? What is the diseases he have? Did he did any procedure? Then you move to your own assessment, and all the department have a documented assessment chart, right? And you can explore that assessment and highlight the abnormalities, and you can also relate the information together. Let's say you have a patient, he have, let's say he is in having a kidney disease and have no urine output, let's say. You mention also what's the kidney functions. Okay, what are the lab results for the kidney functions? What are the medication giving for the kidney disease? Okay, so you are relating the systems assessment with the medication, with the ongoing medication and abnormal or normal lab results. Okay, and also what are the expected procedures? Okay, so he's having a kidney disease. He is on. They tried Lasix. He's scheduled for hemodialysis. right? So you are mentioning the things related to each other. You are connecting the dots. Then you mention your recommendation. What is your recommendation? What is your recommendation? Pending orders. Carry out the pending orders. Let's say this today, the nurse has to do, take the patient to CT today. This patient is scheduled for blood transfusion. This patient is scheduled for transfer, okay? And also to continue care, right? You started and you already continued care from previous shift or started new care for this patient. Your nursing care has to be continuous. How is the nursing care is continuous? Through handover and through documentation of that nursing care in the nursing care plan. So you have a nursing care plan, you initiated the nursing care plan, and you are using the nursing care plan to deliver the care, document the care, and you want the next shift to use the same nursing care plan, okay, because you explain why this patient needs a nursing care plan in the assessment, right? You came up. Yeah. Okay. So you ask the patient, what is what you ask the, you mention the nursing care plan for the problem that you already came out or summarized in the assessment. So here you will mention your nursing care plan. Okay. So let's have an application for this. I will let you now do the honors and apply this in this scenario. So I'll give you one information about the patient, and you try to structure it in SBAR method. So these are the narrative information, original narrative about this patient, and I need someone to tell me how can I deliver this information through SBAR. I'll give you 2 minutes. So 2 minutes passed already. Who can tell us how can you deliver this information in SBAR method?
Situation patient is
No, like from this side. You ladies, please can you tell us how to deliver this information in SBAR method? Now this information, we have the SBAR method. Use the SBAR method to deliver this information.
Can you read please? We cannot see.
Okay, I wish you would ask before because I already leave it for 2 more minutes. Okay, the one who can see.
Really too far. We cannot see.
Yeah, I know. I thought you see from beginning. Okay, so what do you think? Next one I will make it larger. Next one. Next one, okay? No, saying that it's about communication through this information. Now this we have position. Here, name, can you read it? Okay, tell me what's the SBAR communication? No, tell me through this information. Use the SBAR method. Use the SBAR method. Can you use SBAR method again? Tell me
decided to just take liquid creatinine is elevated 2.9. And the recommendation is
Huh?
is creatinine.
So, guys, what is the problem here? Huh?
No, difficulty breathing. Difficult breathing.
What's the problem? Elevation only? What's the problem? All this, which one? What's the problem?
The
What's the
B
problem?
is telling you need to give diary. For that, creatinine is high.
Exactly. Now in PE study, this is the patient is scheduled for PE study. Okay, you know if you have doing contrast, if you receive the contrast, you need normal kidney function and creatinine here is elevated. So I know, doctor already know, he will go for PE study schedule, but you receive creatinine high. This is the new, and doctor already think creatinine is normal, renal function was okay. Now it's elevated. So we need to think, should we do the PE? Is it really cannot wait, or can we give something to reduce the creatinine? Can we do anything? Can we choose another method? So now this is the situation is PE study and oil creatinine is 2.9. This is the situation. The background is he is an ER, and don't forget the situation. Introduce yourself and the patient. Okay, so you have to say the same name of the patient and introduce yourself and say hello to Dr. Ali. Okay, so this is starting with this conversation. Greeting. Then your background is coming from ER, you have chest pain, and you found out for your assessment is that he have the pain, the quality of the pain, and your recommendation is start choose another method or reconsider the PE study. Okay, this is how we apply the SBAR communication in this scenario. So this was just, let's say, as a beginning, rough beginning, but we'll try the next one. Okay, this one I will make it bigger for the people at the back because they are. This is as big as it gets. Okay? People in the back? You can see now? Can you see now? If it's too difficult, there is an empty chair here. There is an empty chair here. Really, I'm sorry. This is as big as it gets. tell us.
Situation.
Okay.
Patient have a new episode of tachycardia, 120 to 130.
So if you start your conversation, let's say to that person, his name is Dr. Ali. Okay. Imagine him, or I think it's me. Like how you will say it.
Dr. Assalamu alaikum.
Alaikum assalam.
Regarding patient Jamal in
Yeah.
ICU bed 5.
Yes. May I know your name?
My name is Dr.
Yes. Hello.
Hello.
Yes.
This patient have new episode of tachycardic, 120 to 130. This is the situation.
Okay.
The background, the patient have AFib before, so the patient highest heart rate is 90s, up to 90 only. This patient developed newly to 120 to 130. This is bad. This patient was on comedian 5 mg and digoxin
Okay.
5 to 5 mg prior to hip surgery.
Okay.
Now we stop because of post surgery protocol.
Okay. So he did not receive it after surgery?
Yes.
Okay.
Do
So
you
this
want?
is background.
So
Assessment, we assess the patient, his BP is normal 120 to 80 and he is asymptomatic.
okay.
And recommendation for any ECGs or cardiac engine and for any.
What about those medication Coumadin and digoxin? Huh? What about digoxin and Coumadin?
I told you.
Huh? Are they still on hold?
Do you
Ah,
want
still
to
on
give?
hold.
Huh?
I told already, post surgery we hold.
So they are on hold. So
You want
this is like a recommendation. So like you think because of this it was it would actually specification they really to control heart rhythm, abnormal heart rhythms. So they are being hold due to the surgery to EO. Okay. Yeah, so it's not serious. That's why he is having the symptoms again. So probably resuming those medications is the good idea. Okay. Okay. Thank you very much. Yeah. Thank you.
Thank you.
So this how was SBAR was being conducting this. Let's talk about one more, nurse to physician. I will keep it for the people at the back because okay.